This is a Jet 24, Fox 66, your Erie.com special report.
Good morning, I'm Samira Nefsi. We interrupt our programming to bring you a special report on the spread of COVID-19 in Erie County. We're going to go live to the studios of WQLN TV, and here is County Executive Kathy Dahlkemper right now.
Good morning, and thank you for joining us as we talk about the COVID-19 pandemic here in Erie County. We have 10 new cases of COVID-19 to report in Erie County as of 3 p.m. yesterday, which brings us to a total of 408 cumulative positive cases in Erie County. There are also 2 additional deaths being reported. As of 3 p.m. yesterday, we had 243 recovered cases, 157 active cases, and 8 deaths. We do not have any more information on these cases or the additional deaths. Of the cumulative cases in Erie County, 54% are female and 46% are male. And here is the breakdown of the total cases by age. 3% are 0 to 4, 1% are 5 years to 9 years, 5% are ages 10 to 18, 13% are ages 19 to 24, 44% are ages 25 to 49, 22% 50 to 64 years, and 11% of the cases are in those individuals who are 65 years or older. Please note that the percentage values have been rounded, so it may not total exactly 100%. Regarding race and ethnicity of our total cases, 51% are white residents, 34% are African American or black residents, 6% are Asian residents, and 2% are multiracial residents, with 2% being other and 5% being unknown. Regarding the Hispanic origin, 81% are not Hispanic and 7% are unknown. Are multiracial residents, with 2% being other and 5% being unknown. Regarding the Hispanic origin, 81% are not Hispanic and 7% are unknown. I'm going to have to check on that number. It seems a little bit complicated on my page here, so we'll get that number up on our website. Now we understand that a few businesses have decided to open in the yellow phase, and we understand that the decision of these business owners was a difficult one. But please understand the risks to your business and how that could affect both your licensure and your insurance. And the county does not endorse any business going against the state's order in the yellow phase. I would like to advise you to talk to your legal counsel before you decide to open, so that you truly understand the risks you may be taking. Thank you to all of our businesses and our residents who continue to work so diligently to follow the guidelines for safe operations of our businesses that are open here in Erie County. I ask all of you, whether you're going to a business, going to work, or whether you're out enjoying our beautiful community in these summer days, please continue to keep that 6-foot physical distance from those who do not reside with you in your home. Wash your hands frequently with soap and water for at least 20 seconds. Sanitize your surfaces regularly, particularly those surfaces that are often touched. Wear a mask. This is so important, and the evidence continues to grow that wearing a mask anytime that you're outside of your home is one of the best things you can do. It protects you and it protects others. So my mask, again, is for all of you. Your mask is for me. But there's even some evidence that's growing that my mask may help me and your mask may help you. Today, I have with me, and I'm grateful to have the Director of the Erie County Department of Public Health, Melissa Lyon, and I also have Charlotte Berenger, who is our Director of Community Health Services at the Erie County Department of Health. They're going to share updates from the Health Department, and we'll start with Director Lyon. Melissa? You're on, Melissa.
Thank you. Can you hear me okay?
I can hear you.
Great. So today I would really like to focus on what I believe to be data discrepancy that has the community very concerned. There seems to be distrust and misunderstanding of how public health data collection occurs and is reported. So I'm going to go over what we typically do and then compare it to what's happening in a pandemic. So typical population health data is collected over time and it's entered into a database designed to collect the specific data. So for example, we have vital statistics databases, there are cancer registries, chronic disease reporting, and so on. And each collection method and parameters are unique. So once data is typically collected, it's then reviewed in what we call scrubbed to detect errors, duplication, and outliers. Once that's completed, the data can then be used to report trends, conduct comparisons, track rates over time, create graphs, and so forth. Rarely is this ever done in real time. So for example, when we do influenza reports, they're typically a weekly report, and they actually have at least a week's delay. For our sexually transmitted diseases and infections, we do incidence and prevalence, and we often compare those annually, biannually, or monthly. So comparisons will typically occur for data weekly, monthly, quarterly, or annually. But in real time or daily, almost never. So the COVID-19 pandemic had people wanting case numbers, trends, hospitalization rates, death rates, recovered rates, active cases in real time. Everyone wants this data today. In all honesty, the public health data collection system, their analysis, and the reporting system, it's just not designed to do this. The system that we're actually using for COVID-19 in this pandemic is what we call a disease case investigation system. It contains loads of information, demographics, symptoms, laboratory reports, outbreaks, details connecting to other cases. It isn't a simple case count system. It's not just numbers in a data collection place. So it's interesting as we reflect through the pandemic, as public health practitioners, we heard the request that the community and the media wanted and needed daily real-time data. We've been doing our best to provide that data that was meaningful to describe the severity of the COVID-19 pandemic for our community. But by doing so, we've almost set ourselves up for criticism, and that our numbers are wrong, or made up, or useless because they might contain errors. But I want everyone to really think about this, because it should be expected that real-time data from time to time can have errors, or it may not match the local or state reporting processes. And that's because we refer to this data as raw data. So you as the public and media are receiving what we call raw data. And raw data has value, but it takes time to turn raw data into meaningful data. And that time is something that unfortunately we don't have during a pandemic. So this leads me to the issue at hand. Why does Erie County daily counts and PA Department of Health daily counts not match every day? ECDH, the Erie County Department of Health, is using a different reporting time frame. It's still a 24-hour time frame, similar to the Pennsylvania Department of Health, but it isn't the same time frame. So we at the Erie County Department of Health, we report 3 p.m. to 3 p.m., so a 24-hour period, and then we report that at 9 o'clock a.m. the next day. Pennsylvania Department of Health downloads their data every evening at midnight, and they report out at noon. This would probably lead you to ask, why is the Erie County Department of Health using a different report cycle? Truthfully, it has to do with the workload and workflow of case investigation and reporting. This provides us more time throughout the workday to collect and review and report the data. I see that it's confusing, and I apologize for that. And I want you to know that as an accredited health department, as any accredited health department will do, we would review this process, we will make adjustments as necessary, and will continue to improve. So please keep in mind as we do this review, it will take time and it will take staff time. But I want you to know and trust that your Erie County Department of Health is reporting data that is accurate and reliable based on our workflow and our workday. Thank you for letting me speak today. Back to you.
Thank you, Melissa. And now I'd like to turn it over to Shar Beringer to give us a bit of an update on the health services side at the Department of Health. Shar? We can't hear you, Shar.
Could you repeat the question again, Kathy? It was a little bit garbled.
I'm going to have you speak to give us a bit of an update on the clinical side from the Department of Health, unless you want to just be here to answer questions.
One thing I would like to comment on is some comments that were made by the World Health Organization recently that caused a little bit of confusion in the national media. There was initially a statement made that asymptomatic cases were perhaps rare. World Health Organization came out the next day and basically qualified that. Said they really don't have good data, on how often asymptomatic cases contribute to disease counts. But I think what the public does need to understand is that there is pre-symptomatic disease spread. So we know that with COVID disease, people can be infectious 2 days before their first symptom. So we call that pre-symptomatic spread when it happens that way. The asymptomatic spread, where someone truly does not have any symptoms but still come out with a positive test throughout the full 10 days of isolation, never have any symptoms, there's really not good data yet on how much that is influencing our case counts. Other than that, I'm open to Q&A.
All right, thank you, Shar, and we'll get to the questions. But before we do, I just wanted to clarify regarding the origin, the racial and ethnic origin numbers that I gave. Regarding those Hispanic, we have 12% of total positive cases listed as Hispanic, and we have 81% not Hispanic and 7% unknown. So I wanted to clarify that, so thank you. And now I'd like to turn it to the media for questions, and today we're going to start with Erie News Now.
Yeah, hi there, Kathy. This is John Laddick joining you today. Thanks so much for the weekly updates. I don't know if this is a question you or Melissa want to answer. Obviously, she clarified about the data discrepancy. At this point, which would you rather the public media be following, the county or the state data? Which do you think is the best to follow at this point, and why so?
I'm going to have Director Lyon address that.
Yeah, thank you for the question. You know, I would say it's a personal preference, to be honest. The numbers at the end of this pandemic are going to add up to the same. I can guarantee you that after all of the scrubbing and the analysis and determining which cases may or may not fit that. I think from time to time the state is doing a very robust review of data, and it's trustworthy. If you want to know what we're doing day to day and how we're handling caseload day to day, then follow what we're doing in reporting. Because ours really would say, if you see numbers that said there were 28 cases on a specific day, you can be sure that we were working on those 28 cases in a 24-hour period. If you see 10 cases, then you'll know we were working on those 10 cases in a 24-hour period. So it would depend, do you want a local flare or do you want the state compiled?
And Melissa, a follow-up to that, what is the process then if the numbers are off that you and the State Department go back and forth with to clarify those numbers and kind of get on the same page? If you could expound upon that process.
Yeah, it's not something that's done on a daily basis. Ideally, what happens is there's information that comes into the disease surveillance system, which I had said to you is a case investigation system. It's not so much of a data collection. It collects data, but it's not functioning the way that people would like it to function maybe in the public, where we're just counting cases. So information gets added into there. And then information is also added in by case investigators. And so throughout the adding of additional information is where that clarification begins to happen. So we would be the ones that determine probable cases, for example. A probable case doesn't normally have a laboratory confirmed with it. So the case investigators adding that case in there. So it's not done like day to day at 9 o'clock every day. It's an ongoing process that we do. Shar, is there anything you'd like to add to that?
I think you described it very well. It really just comes down to reporting within different time frames. So the numbers are going to vary between the state and our local numbers.
But I think if we paused at a certain date and neither one of us reported, you would see that those two numbers would then eventually match up, if that makes sense. We always catch up. We're one ahead, a couple behind. It's just based on our reporting process. And we're going to revisit that, just so everyone's aware.
Thank you,
Thank you much.
Jet TV.
Yeah, hi, Kathy. It's Samir. So, really fast, Governor Wolf last week on Friday mentioned that he believed Erie County was facing an outbreak, possibly high numbers of community spread. So I guess, would you classify us as facing an outbreak?
We are definitely seeing community spread. It's something we've talked about many times in these press briefings. We saw some community spread before, but nothing as widespread as we're seeing it. But I would really prefer if maybe Shar Behringer would talk about community spread and outbreak, or Director Lyon, one or the other, could speak to that, please.
I can certainly address that. Way back when the pandemic started, a definition of community spread was put out by the State Health Department that basically when we reached 6 cases where we didn't know where the person, when we interviewed them, didn't have any idea where they possibly contracted the disease, that is called community spread. So we've been at community spread for quite a while in our community. When we look at our trends in numbers, whether it's the daily numbers, whether it's the 7-day numbers, whether it's the 14-day numbers, we're continuing to go up right now in these last couple weeks. An outbreak talks about numbers of cases, and our numbers of cases are going up. I think it would be fair to say that we have an outbreak, yes.
Erie Times News.
Hi, Kathy. It's David. This one's probably for either Melissa or Shar. I think, Kathy, you had just said 34% of the cases involve African Americans. I believe that is a pretty significant increase from earlier on in the pandemic. If we can, what are some of the reasons for this, and what are some of the ways that the county health department is going to try to address this?
Melissa or Shar?
Shar, I'm happy to take what we're doing right now in our community outreach. So we do know that our most vulnerable populations across the country tend to be Black or of New American, health literacy issues, income, housing, all of the social determinants of health, as we've been talking about for those of you that follow public health for a very long time, we know puts populations at a higher risk of poor health outcomes and increased death rates. So we acknowledged that very early on and worked within the community centers and what they wanted to be doing for an enhanced outreach and screening. And we've done some additional testing in those communities as well. Now, the great news through that testing was we did not find a large number of disease lurking in those communities, which was really a great outcome. To talk about why it may have had a large jump, I've not been on those clinical calls lately, so I don't have that information at my fingertips. So I'll default to Shar if she has something additional to add.
Well, in general, when we talk about disease spread, we know that some behaviors that we can use do help control community spread. Those behaviors are wearing the mask, particularly when we're within 6 feet of anyone, and maintaining that physical distancing of 6 feet. It's hard to do that, especially as the weather is getting nicer. We want to be outside. We want to get that sunshine. But that is the major way that we can control the exposures that we have to disease and the spread of the disease in our community. When you look at housing also,
the percentage jump among African Americans? Is it? Are you saying that it's because people are outside more? I mean, and does any role in terms of the protests recently? Does that play any role in the increase we've seen in the percentage of cases being among black residents of the county?
We do not know that specifically. We know that any time that there is a crowded situation where people are close, where people are not wearing masks, there is certainly the risk of increased disease transmission. We do not know specifically if any of our recent cases are related to that. Again, incubation period is 2 to 14 days.
Thanks, Shar.
Thank you, David. Talk Erie. Joel, are you with us?
Yes, hi, Kathy. It's Joel Natale. Can you hear me okay?
I can.
Thank you. Hey, a question for our guests. From March 18th until deep into May, the county reported their own PCR confirmed case count, but then we stopped and started adopting the state case count for a while because of the workload burden. Does the County Department of Health know specifically how many PCR virus positives, how many probables, and how many positive antibody tests that there have been?
Shar?
Okay, the numbers that we report out are a combination of both the PCRs and the probables. Because from a disease investigation viewpoint, they are handled in the same way. The antibody tests at this point, no, they are not being counted. They are not relevant to our current mitigation efforts.
So just as a follow-up, Shar, Secretary Levine and the CDC are reporting antibody test totals. So would that mean that we should not look at the state numbers if we want to know what kind of current viruses that we have in our community?
The antibody numbers do not tell you about current virus in the community.
Right.
The antibody tests tell you about past disease in the community. It's the PCRs and the probable numbers, which is our total number that is let out on a daily basis. That is current disease in our community.
So again, with the state adding antibodies, that would make them a little bit less trustworthy as far as what current rate of virus is right now, correct?
The state is not putting antibodies in their total numbers. They may be reporting them separately, but they are not including them in their total numbers. That is our understanding from the state.
I appreciate it.
Thank you. Erie News Now. John.
Yeah, hi there, Kathy. A question for you. I know you addressed the county's perspective on businesses opening despite being in the yellow phase. Do you and the county have any plans for enforcement on some of those businesses? And if not, what would it take for potential enforcement in terms of crowd numbers and businesses?
So we do not endorse any business opening and defying the mandates, the orders of the governor and the state. And we will be doing, as we've always done, trying to educate our businesses about the yellow phase and what is allowed and what's not allowed. And so if we know of a business that has been open, we will be in contact with them through a letter and email stating such that they are in violation, and also with the understanding that this is difficult for them, but they should definitely get legal counsel before they make that move to make sure that they are not putting their business in the long term in jeopardy.
Is follow-up on that, is there a specific threshold? I mean, just if they're open, or if there's a certain amount of people? If
you're open and your business is not allowed to be open in the yellow phase, then we will be sending that notice to you. And if there's anything within the jurisdiction of county government, of course, we will continue to enforce county government's jurisdiction as we always have. But if it's a violation of state mandate, we will be reporting that to the business, and we'll also actually be keeping records of that, and reports of that also will be going out.
Thank you.
Jet TV, Samir.
Yeah, hi, Kathy, Samir. So really quick, so then on Friday, just to follow up, I guess, regarding the businesses, why, I guess, did you not make that a little bit more clear that the county would enforce? I mean, by no means did you say, yes, go ahead and open up these businesses, but you just said with limited resources, you guys would be focusing on other things. So I guess why now what seems to be a change of heart?
It's not a change in heart. It's not a change in philosophy. And maybe I wasn't clear enough on Friday, but I never, ever said that businesses should not follow the state orders. And, you know, they do put themselves at risk. And we've been saying this all along. When we went from red to yellow, we said this to businesses also. And they put themselves under great risk of losing potentially their license, fines, their insurance. You know, there's a lot of inherent risk to doing this. We want businesses to be aware of that. What I did say is we have to get back to the business of county government, and all of our enforcement team that we've been using these past 3 months is mostly our environmental team, the people who go out and inspect our restaurants, our tattoo shops, our campgrounds, our septic systems, and so many other things, and pools, beach water. So we have to get back to doing the business of county government, our typical business wheelhouse, for the safety of the community. And so those resources have to be realigned to go in. Now that we have restaurants, for example, even with outdoor seating, we have to get in there and do restaurant inspections. And so we've got to get back to that business, and we don't have the resources to continue to do the very, very strong, comprehensive enforcement that we were doing, particularly under the red phase and even moving into the yellow. And again, as more things open, you know, with last week's our beaches opening and restaurants having outdoor seating, we just see our resources being pulled in too many ways, and we've got to get back to the core of what we are mandated to do.
Thank you. And then have you spoken to the governor's administration following yesterday's announcement that Erie County would not be part of the next batch to go into the green phase?
The governor made an announcement that we're not part of that yesterday?
Well, no, I said, have you spoken to his administration since Friday?
Oh, Friday. I thought you said yesterday. I have talked to a representative of the administration, continuing to push, obviously, that I believe we're ready to go to green in this community, and I will continue to do that. Erie Times News?
Thanks.
David, are you with us?
Hi, Kathy. I can barely hear you.
Okay, maybe we could get the person here at WQLN to try to, the volume does seem a little low today. I don't know if there's any way that we can up the volume here. But anyway, is that any better?
Sure. Yep, I can hear you a little bit better now.
Okay.
My question, the state has been publishing specific data on nursing homes, long-term care facilities, and the numbers have been strange, to say the least. Currently, they're listing 5 deaths at Erie County long-term care facilities, 19 cases among residents, 15 among staff. Is that accurate? I know there have been many mistakes with this particular piece of data from the state. Is there anything that Melissa or Shar might know about the accuracy of this? Is this data we can use? Has there been 5 deaths at long-term care facilities in the county?
Melissa or Shar?
When we report deaths, it's basically from information that we receive from facilities. I am not positive that the 5 is accurate, but it is certainly close if it's not totally accurate. We know that in the past week or two there have been some discrepancies with specific facilities, and those have basically been data entry errors on the state's part. We send data to the state, they put it into their database. We don't enter directly into their database, long-term care facilities. And I'm sure that you've seen it. It's very small print, even when enlarged. And some lines got transposed, and to the best of my knowledge, that has been straightened out now for particular facilities.
And do we have any idea what the county's hospitalization rate is for COVID? I know the national hospitalization rate is 82 per 100,000. Do we have any idea if we're close to that or what our hospitalization rate is in Erie County?
Okay, hospitals rate is reported by the hospitals. That is not reported by the Erie County Department of Health.
Okay, so that's not something that the county has. They don't have a track on that at all.
That is correct.
Okay. All right. Thank you, Shar.
I have seen that information on the state website, and so the hospitals are reporting, I believe, to the state, and I would recommend that anyone who's interested in those go on the PA Department of Health website to gather that information. Talk Erie, Joel.
Yes, hi, Kathy. This one's for you. On Friday, you had said that you were waiting for metrics Thursday night from the state. You know, what is the goalpost, if you will? Do you have those metrics now, what they're looking for Erie to be eligible for green?
Not specifically. There's nothing been specifically relayed to me that this is where we need to be for green. But as I've said before, the metrics have changed over time, which I find very frustrating. And I know we're in a pandemic and things haven't been continuing to evolve, and I'm trying to be as understanding and patient as I can, but this is our community's future and not even our future, our current situation. And so it is frustrating, and I would certainly welcome more communication to my office from the state on this. And I don't know if Director Lyon has anything further, if she's gotten anything further on the metrics that the state's using, but I'll just turn it over to her to respond to that.
Thank you. My understanding is that the state needs to see our community either level off in the number of cases over a time frame or time period, and in particular a 2-week rolling total, or begin to decline. And I've asked for additional communication with the epidemiology team and the Secretary of Health as they're looking at that information. Will they share it routinely and regularly with me? And recently, I did just get an update late last night that on the 14-day case count over the 2-week period, on June 9th, we were now at 144. That's up 90 additional cases. So that's the moving window. That's a 2-week period, so we're up 90. We're watching the numbers to see where the trends are going and in communication. But the goalpost, to my knowledge, is keeping case counts level and then in the declining direction. And I can't predict when that will happen for us as a community.
Just a quick follow-up, Melissa. One of my colleagues is reporting that we needed to have less than 10 cases over 14 days in order to go green. Has that been a metric that you've heard of?
No, I'm not aware of that metric at all. The 10 cases per 100,000 over a 14-day period, if anything, it would tie back to the data that they were looking at in order to go yellow. But even that's not incredibly accurate on how it's been relayed to you. So the short answer is no, I'm not familiar with that metric.
Thank you.
Erie News Now, do you have any last question?
Yeah, 2 quick ones for you, Kathy. I know Representative Bizzarro had talked last week about he is encouraging businesses within the county to go green, or within his district at least. Have you had any follow-up discussions with him about those comments in terms of informing businesses to operate under that sense?
Not about that specific comment.
Okay, and then the other follow-up, I believe it was Monday, they released the county dashboard, I believe with the state health department, in terms of what metrics or what things they're looking at. What are your thoughts on that website, and does that cause you any concern when you look at what that's reporting and how close or far away, for that matter, Erie may be?
Well, again, my frustration continues to be that the metrics seem to keep changing. And at one point, they were using the Carnegie Mellon University data dashboard, and it just seems to keep changing, and it's just frustrating for our community. And I believe, this is my opinion, that the state needs to look at more than just the disease rate. I know we're in a global pandemic, but we're also in an economic crisis. We know we are definitely in a recession now. That has been already shown to be proven. We know that there is much anguish and fear and anxiety and all of that from people out there who for a variety of reasons. They're concerned about the virus, they're concerned about their job, they're concerned about paying the bills, they're concerned about so many things. And I think we really need to look at all of the factors and find a safe way to open up our community so that people can get back to work. And again, I'm going to say this over and over again, our businesses that are open are really doing a great job in trying to protect us. I truly believe if the governor would put us to green, that those other businesses, when they open up, will also do their due diligence to protect us and to protect their employees. And so we have to trust our businesses and know that our economy, if it doesn't get going, we're going to have more deaths and more illness and more problems from the economic fallout from this than we've already had.
Thanks for your time today, Kathy.
Sure. Jet TV, Samir, do you have any other question?
Yes, just one more. Taking into consideration, we now have Presque Isle beaches open as well as outdoor seating at area restaurants. Do you think we're kind of going further down the rabbit hole, of course, an increased chance of COVID-19 numbers? So do you think this is kind of hurting our chance of going to green, being in it as long as we are, or if we stay in it?
Well, I find it very frustrating that when the state says we cannot go to green, on the same day they also open up our beaches and allow all sorts of tourists to come here. Now, we always want them to come here for our economy, but they are bringing COVID-19 into this community. I can pretty much guarantee you that. And our people are also going out to these other communities surrounding us to get their hair cut, to go eat inside of a restaurant, to do other things they can't do here. And that COVID-19 is just always looking for a new host. So as people move around more, and I've been talking for 3 months, try to stay as close to home as you can, that just gives more and more opportunity for COVID-19 to move around. So it is frustrating, and it's frustrating when I go out and I see so many people without masks on and without keeping their 6-foot distance. I don't know how else to make this case to the public about how important that piece is. And I can't say it enough, but it doesn't seem to be really making a difference. The more I say it, it just seems like almost these days the worse it gets. So again, not in the businesses. When you go inside of a business, it's still very, very good. But it's when people are out and with their friends and at picnics and doing other social activities. So these are all added factors, and we need to find a way to live with COVID-19 for the next year at least. And so let's work together to do that. But we need our businesses open, in my opinion, to be able to do that. Erie Times News, do you have any final question, David?
Sure, Kathy, and this is for either you or Melissa or Shar. Youth sports teams in Erie County, are they permitted to travel to either green counties or counties outside the state that allow competitions and practices? What are the guidelines for these youth sports teams?
Director Lyon, do you know the exact answer to this? Because I don't have that recreation guideline in front of me, and I don't know it as well as some others do.
I do not have that in front of me either, Kathy.
There are guidelines, and our environmental team is much more in the weeds on this and knows all of the criteria. They've read it and studied it, and it is also on the state website. But again, if we're in the yellow phase and people are going to other counties just around us and traveling, the traveling is the problem. You know, we've talked about having a staycation this summer, that's really the best for all of us, to stay close to home, to not be traveling great distances. And the more you travel and the more you're with other people, and we know that sports, it's hard to wear a mask and be breathing heavy in a sport activity. So mask wearing becomes much more of a concern, in my opinion. And when you breathe heavy in a sport activity, that just causes, if you have the virus, those droplets to go further. So a 6-foot distance is no longer adequate. But yet the game is being played, and obviously you can't always be 6 foot or more away from people, depending on the sport. So those are all the inherent risks and concerns around sport activities for all.
And then a follow-up, a different question. I know we're up statewide to 20 confirmed cases of MIS-C, the inflammatory disease that children are getting that's related to COVID. Have we had any confirmation of any of those cases originating with Erie County children?
I'll turn that over to Shar.
We do not at this time.
Thank you.
Okay.
And Talk Erie,
Thank you, Shar.
Talk Erie, Joel, do you have any last question?
Just one more for Shar. Shar, it's been a couple weeks since the riots downtown. Have you seen any active cases that are connected to protests or other large gatherings, churches starting to reopen and so on?
We do not know specifically if any of our newer cases are related to those activities.
Thank you.
Again, we can only go on what people tell us as far as what their exposures have been.
Thanks so much.
Well, thank you so much, Director Melissa Lyon and Charlotte Berenger, for coming on with me. Of course, two people who I greatly respect, who do great work and have continued to do great work over many months for us here in Erie County as we all deal with the pandemic. And before I close, I want to say it's your weekly reminder to please complete the 2020 census. Again, I cannot express how strongly enough how important this is to our community's future and the funding that we will get for any further pandemic or the multitude of other services that we get funding for from the federal government. So the response numbers for this week are 69% of households throughout Erie County, and the city, of course, which is part of the county, but specifically within the city, 60% of the households have responded. So we still have almost 30% in the county and 40% within the city that we need to respond. We'd love to have every single person counted in the 2020 census. You can complete the 2020 census by going to that's MY, 2020census.gov, or by mail. You would have received some mail about this, or you can call 844-330-2020. And there are also trainings, jobs still available. They're currently training and being organized, the census employees, and you can apply online at 2020census.gov/jobs. So if you need a job, or if you just want to help our community get counted, then please think about helping out with the census this year. And finally, just as a final note, I'm glad to be with you here today, and I will be back next week. But in the meantime, I do ask you to try to stay as close to home as you can. Always, always wear your mask when you're out and with other people, and keep your 6-foot distance. And during all this time, please do what you can to stay safe and to keep your family members safe. Please remember to stay calm.
And you've been watching today's update on the COVID-19 spread here in Erie County from County Executive Kathy Dahlkemper. Now, in case you were just joining us, here are some highlights from the press conference today. There are 10 new COVID-19 cases here in Erie County. That brings us to a total of 408. Good news, however, 243 people have recovered, leaving us with 157 active cases. Unfortunately, there were 2 new deaths, so that brings us to a total of 8 deaths here in Erie County. Breaking down percentage-wise, women seem to be leading with COVID-19 here, 54%, 46 are male. Now, the age group with the highest number of COVID-19 cases, with just over 40%, that'd be people between the ages of 25 to 49. So yeah, definitely an interesting number there to see which group has the most COVID-19. Now, big question. Does the county support businesses opening under the yellow phases if we were in the green, as State Representative Ryan Bizzarro said on Friday? Of course, Governor Tom Wolf not allowing Erie County to join that next batch going into the green phase. State Representative Bizzarro urging businesses to act as if we were in that. The county does not approve of that. They say they are not supporting businesses doing that. County Executive Kathy Dahlkemper mentioning during her press conference that you really should still abide by the governor's order and seek legal representation if you choose to move forward without the permission of the Commonwealth to do so. Of course, saying she still wants everyone to stay safe under that. And then discrepancies between the state numbers and the county. We had Director of the Health Department, Melissa Lyon, on today speaking as well to that matter. And what she was saying, Erie County reports from 3 p.m. to 3 p.m. and then they released their information around 9 o'clock or so the next day to the Commonwealth. So that's where some of the discrepancy. Now the state, however, they get their information collected all at midnight and then they release their numbers at noon. So they're basically saying what the county is giving us is that raw information, not raw data, and then they need to refine that a little bit. Now, as for who you should be following, the Commonwealth or the state, or excuse me, the state or the county, they're saying that's basically up to you. That's your preference on who you'd rather get your information from. However, Director Lyon at the end of the day saying no matter what happens at the end of this pandemic, the numbers will align and everything will work itself out. And then we also did ask, of course, Governor Tom Wolf last week mentioning during his press conference that he thought Erie County was facing an outbreak. Shar Behringer of the Health Department also saying she would agree with that, saying that that is a fair statement. Now let's get to some of the numbers. As of this morning, here are the latest COVID-19 numbers in our area. As of right now, here in Erie County, 408 confirmed cases. That is 10 new ones in the past 24 hours. There have been 2 more deaths added, as we mentioned, bringing us to a total of 8. Crawford County reports 31 cases, Warren County 5. There are 104 cases confirmed and 6 deaths reported in Chautauqua County, New York. There are 375 confirmed cases in Ashtabula, Ohio, with a death total of 38. Now, across Pennsylvania, there are more than 76,000 people who have tested positive for the COVID-19 virus. Over 6,000 people have died and nearly 460,000 people have tested negative. Now, best advice to stay calm, stay safe, and wash your hands. Often practice social distancing. Of course, wearing a mask. County Executive Dahlkemper reinforcing that today. And we will have much more on this today at noon and a complete wrap-up tonight on Jet 24 Action News beginning at 5. And we are live on Facebook nightly at 7 p.m. Thank you for joining us. I'm Samir Nefsi. Have a good morning.